Tetrology of Fallot, a fairy tale. Once upon a time, the king and queen of a faraway land celebrated the birth of their daughter. The princess seemed perfect and healthy. At the royal naming ceremony, a clairvoyant, wise woman touched the baby and sadly declared that she would die of a broken heart. The royal parents resolved to monitor the infant closely, and as weeks went by, the princess began to display alarming symptoms. Sometimes when she would cry or have a bowel movement, she would become very blue, would gasp for breath, become limp, and even lose consciousness. Her fingers and toes developed abnormal, rounded nail beds, and she was desperately weak and thin despite all attempts to increase her milk intake. The worried king and queen consulted the finest healers, who examined the princess and began doing tests. A chest x-ray showed an elevated left ventricle, which appears as a boot shape and is known as cœur en sabot, which is French for wooden shoe. An ultrasound exam of the princess's heart, called an echocardiogram, clearly showed a connection between the normally separate left and right ventricles. Computed tomography scans confirmed the missing wall between the ventricles and a misplaced aorta, and showed an enlarged right ventricle, a narrow passage leading from the heart to the lungs. Based on these images, the healers declared that the princess was suffering from a heart abnormality known as Tetrology of Fallot. The healers assured the royal parents that 1 in 3,000 babies are born with Tetralogy of Fallot, and that advances in cardiac surgery make this a correctable condition. The queen wanted more details, so the healers elaborated on the 4 elements of this complex heart defect. First, the hole in the wall between ventricles is called a ventricular septal defect, or VSD. Normally, the ventricles are separate so that the heart can simultaneously pump oxygen-rich blood to the body and oxygen-depleted blood to the lungs. The defect allows the oxygenated and deoxygenated blood to mix, so that the body constantly receives less oxygen than it should, no matter how hard the baby breathes or how strongly the heart pumps. Secondly, the normal aorta is the pipeline for oxygen-rich blood leaving the left ventricle and going to the rest of the body. Overriding aorta is when the aortic valve is enlarged and appears to arise from both the left and right ventricles. The greater the degree of override, the more blood enters the aorta from the wrong, which is the right, ventricle. Thus, override makes the VSD blood mixing even worse, further decreasing the oxygen to the body. The third and fourth defects are linked. Pulmonary stenosis is a narrowing of the pulmonary valve and artery, which lead from the deoxygenated right ventricle to the lungs. This blocks blood flow to the lungs, meaning that fewer blood cells are picking up new oxygen. The pumping right ventricle is working against increased resistance due to the blockage, so it keeps pumping harder, which in turn makes its walls thicker and more muscular. This increase in right ventricle muscle is called right ventricular hypertrophy, and it pushes the pointed apex of the heart upward. All these defects result in a heart which cannot pump enough oxygenated blood to the baby's body. Using up the available blood oxygen can cause sudden cyanosis, when the baby's skin, lips, and nails turn blue from the lack of oxygen, and it's called a TET spell. TET spells may result in seizures, hypoxic brain injury, neurological deficit, and even death. Giving the baby supplemental oxygen doesn't really help, because oxygen isn't getting from the lungs into the blood. Putting the baby in a knees to chest posture can improve circulation to ease the TET spell. It was determined that for the princess to survive, she would have to undergo open heart surgery. When treated with total surgical repair, most patients have good to excellent cardiac function. Success largely depends on the patient's anatomy and the skill of the surgeon performing the operation. The top cardiothoracic surgeon in all of the land was called in to remove the blockages and to patch the holes in the princess's heart. The surgery was a success, and the princess ceased having symptoms of oxygen deprivation. The princess thrived with her corrected heart, and the healers predicted that she would live just as long as any other person in the kingdom. Thus the princess had her broken heart fixed, and as the story so often goes, she lived happily ever after.